Hello, it is Shani. I'm here at my PCORI Investigators meeting. I speak at 1:30 p.m. and today I'll be sharing insights about um, my experience as a patient partner with the tested study and how the particular medical intervention that was given to my mother, Mrs. Cassie Osborne Collins, really saved her life. And so I'm really excited to share and a little bit emotional about it as well. But we are here at the Crystal Marriott in Arlington, Virginia, and I look forward to sharing with the audience of principal investigators and coordinators who are present today.
We really started engaging with both of them, and including Reams back in 2019, even before we submitted our first grant, to really get their perspectives at the time of study design, and that their input has changed the study very meaningfully throughout these years. So we're so incredibly thankful to all three of you for your input, and can't wait to hear about your journey to here and how we view us.
Very positive with that ad. Well, good afternoon, everyone. My name is professionally Dr. Shani Collins. I'm an associate professor of social work at Boston Peace State University. And I came into this study after having met the wonderful Dr. Mystery at Vanderbilt University with my mother, Cassie, experienced a brainstem stroke in 2019. And many of us may think about a pandemic that started in early 2020. I say for my family, it started, our crisis started in 2019 with my mother experiencing that severe medical crisis. But I'm not just here as a patient, partner, and a daughter to beautiful, wonderful parents who have transcended and gone on to heaven, but I also bring to this space the reality that I was trained in clinical and translational research at Brown University, probably in 2013 when I was finishing my PhD, and I also had worked as a project coordinator with University of Mississippi Medical Center and also University of Kentucky. So patient recruitment, community-based participatory research, teaching engagement was something that I also, is a lens that I also look through when I am working on this project. But as you can see, my parents, Cassie and Charles, and this is here, them in our home in Tennessee. But I was able to help them just navigate the complex medical system. My parents and I have always just had this magical, beautiful, I would say, fantastical relationship where I really admired and respected them because in their own lives, my mother was a teacher for 33 years in the Mississippi school system. My dad was an Air Force veteran who was honorably discharged to provide care for his father, who was dying of kidney disease, and he had to save their land. So Dad left the military and worked for many years as a heavy machinery operator. But growing up, I saw them provide care to their parents. My grandmother lived with schizophrenia. My mother provided care for many years to her. So it was not anything to think of when my parents got sick that I would not provide care and support to them. How I became involved, you may see here, this is January 2020, actually my first time meeting Dr. Mystery, and this was following up after perhaps our crisis which occurred in North Carolina. And that crisis happened because my mother, I started noticing that she had began to get a little sick, and my dad, as you'll see, he was already wheelchair bound. My father had had a series of strokes prior. And my mother was up, has been retired since 55. She was providing care for him. And we were trying to get, Mom, let us help you. Let us kind of help you with this care. No, I'm fine, I have your dad. And so my sister, Kanika, and I were trying to really navigate this process with the parents who were a little bit resistant or recalcitrant. And ultimately, November 2019, my mother experienced a stroke right after the Thanksgiving holiday. She was with my sister. My husband, Timothy, and I went down to North Carolina to assess the situation. She experienced a brainstem stroke. And so for 30 days, my mother was up, walking, between Wake Med, later transferred her to Duke University. She was up walking, and then a few days before she was discharged, she was paralyzed because she experienced another stroke. And so we were in this immediate state of trauma and grief because we thought we were bringing our mother home one way, and here we now are finding ourselves basically going to be having to also take care of my father, who was already disabled, but now mom, who was paralyzed. And this day is the picture, and she was in the hospital at Vanderbilt, but the reason we were at Vanderbilt was because of a follow-up appointment after being discharged from Duke Rehab, and Dr. Mystery was the attending physician who said, this is a stroke. She started to immediately make calls. And so if you heard me last night say that I truly credit God, but I also truly credit Dr. Mystery for saving my mother's life. And I know she's very humble about that, but that is my perspective. And so here's Dad, Charles, looking very distraught and crying at Vanderbilt. And so here are my parents. Mom has had this intervention, which is life-saving, but she is paralyzed. They were sitting up, and Dad, his health had begun to decline a little bit. And why was his health declining? Because Dad was older, had had prior strokes, and was beginning to experience stage 4 kidney disease. And so more hospitalizations were coming on him. And then I also think, because my parents were childhood sweethearts and had been married for all this long time, him seeing Mom, who had all been so strong all these years, it weighs on me mentally. And so my wonderful husband there, we just stepped into that role of caregiving. As I said, it was not unfamiliar to me because I had seen the work that my mother and Aunt Constance had done for many years. And so my grandparents had been in and out of our home, but also I am a social worker. So I knew who to call, the resources were there with the VA. And as you can see, this was probably just a regular Saturday. And they weren't smiling in that picture, but trust me, we had laughs and smiles and so much fun, just all being together. And so that was for about 5 years. And then, as you can see, my parents, ultimately passed away. Dad of kidney disease, very peaceful passing. And my mother, in October 2024, we had come recently from a trip, and she traveled with us, and she helped prepare everything with my father. So she was very engaged, very aware, very alert after this procedure, after the medical intervention. And like I said, it really, the only thing that was different with my mom after her stroke was that she was paralyzed. But she was competent, aware, our lawyers, everyone knew that she was aware. She talked, we joked all the time. But in October 2024, I came home, I wasn't work on Fridays, but my mom said, I have a headache. I said, what's going on, Mom? Let's see, is something going on? And I said, if it doesn't improve, I'm gonna take you to Vanderbilt. And so I ultimately made the decision after she had eaten dinner, and she started to regurgitate. She was awake and aware. I said, okay, Mom, we're gonna go to the hospital. Granted, since 2020, my mother had not really been in the hospital anymore besides just minor little, checkups here and there. And so they diagnosed Mom with a subdural hematoma. And she slipped into unconsciousness and basically passed away at a live hospice very peacefully with myself, my sister Timothy by her side. But my parents lived a very good life, and the quality of my mom's life improved significantly after the intervention and just being a part of the study. They trusted my expertise she did in knowing that I would not have her involved in anything that would be harmful, that would be risky to her. So my mother was aware of what she was participating in. And I said, Mom, you have the opportunity to participate in some groundbreaking research, and I think that you should. And she said, yes. So she was fully aware. And as you can see, they were young whippersnappers back in the day. And so that's just the story. And I wanted to post a positive picture because you can sometimes, this work that you all are doing, the wonderful work, it gets very heavy. But I want you to know that you can see, this is my mom post intervention. And she was very happy. She talked, laughed every day, and she knew exactly what was going on. And again, I give a lot of the credit to my husband Timothy, who helped me because I could not do the heavy lifting that is required in caregiving. And what we learned through the experience was that boundaries do have to be put in place with family members. Both my parents come from a large family. My mother was one of 11. And so her sisters and brothers really wanted to really be involved in day in and day out. But I had to remind them that if it doesn't work for the caregiver and if it doesn't work for the patient, then that's not what we're going to do. And so I kept a big guard around my parents, only doctors, only the people who could bring peace and happiness, which is what I want for them. And then that's just me again. I'm so happy to be a part of the study, and I share and offer a perspective as I can, and when I cannot, I listen. But I'm very grateful to have the opportunity to sit on the Zooms, to learn, and to share any insights that I can. So that's my perspective, and I just want to conclude by saying to each and every one of you in this room, thank you for the important work that you are doing, because it is saving lives, and the intervention that was given to my mother, but also the follow-up care that was delivered by medical doctors and also Dr. Mystery, is why my mother's quality of life improved significantly, and why we were able to walk both of my parents home in a way that honored their dignity and honored the